Now coming to autologous transfusion. As the name implies, it is a blood which is taken from the patient and again transfused into the patient. That is autologous transfusion. It can be done in the preoperative period, which is called PAD, preoperative autologous donation. The patient will donate in the preoperative period, and in the intraoperative period it can be transfused. Acute hemodilution, which can be normovolemic or hypervolemic. Third one is the intraoperative cell salvage. Here no external blood is being used, only the patient blood is being used. Now coming to preoperative autologous donation. This is usually done in stable patient undergoing surgery where you anticipate blood loss and blood transfusion is going to be there. The hemoglobin should be around 12 gram per deciliter or a hematocrit of 35% should be there. The patient might donate around 10 to 15 ml per kilogram. For example, if it is 50 kgs, he can donate up to 450 ml. The donation should be made at least 3 days prior to surgery. That is very important. And it will be stored, and during the intraoperative period, it can be used. Screening and cross-matching is not required as it is done from the same patient. Now coming to normovolemic hemodilution. Here it involves removing the patient blood and you are replacing it with the crystalloid to maintain the intravascular. You remove certain amount of blood and the amount of blood which is removed is replaced with crystalloid. You are adding crystalloid to the blood. By doing this, your hematocrit is going to be low, but the tissue perfusion and blood flow are high because your viscosity is reduced. As your viscosity comes down, your tissue perfusion is increased. Another important thing is the blood loss which happens intraoperatively will contain only fewer RBC because of low hematocrit. Once the blood flow has stopped, the patient's own blood can be returned. Here you are having the volume added and you have the blood bag for the blood which is removed from the patient. You remove around 300 to 400 ml of blood from the patient and the same amount you are transfusing with crystalloid. So crystalloid comes in, your blood comes out. And this blood is infused into the post-operative or the intraoperative period. The blood is collected, is administered in the intraoperative period, and this crystalloid is no more administered. Initially, you add the amount of volume which is removed as blood, you add crystalloid, and the blood is retransferred into the intraoperative period. That is what meant by acute normovolemic hemodilution. Here you can remove up to 1 to 3 units of blood. So around 400 to 800 ml can be removed. 25% is the safe lower limit for hematocrit. Your hematocrit from 33 can come up to 25%. That is the safe lower limit for hematocrit. Hemoglobin cutoff is 7 to 8 gram. This is usually done when there is a high risk for excessive bleeding like major cardiac, orthopedic, thoracic or liver surgery. In those cases, acute normovolemic hemodilution can be tried.